A lobuloplasty can be performed on one earlobe or both. Sometimes patients have more than one deformity per earlobe, and we can typically reconstruct the entire lobe in one procedure. The area to treat will be numbed with an injectable form of lidocaine with epinephrine. The lidocaine numbing works immediately, so all you'll feel is one initial small injection and that's it. The epinephrine takes about 10 minutes or so to soak in and go into effect. This medication vasoconstricts, so it narrows all of the small blood vessels in the earlobe and makes for a virtually bloodless procedure. The deformed portion of the earlobe is then removed and sutures are precisely placed to give you the best result possible and restore your beautiful earlobes. Your sutures will stay in place for about 8 to 10 days and then will be removed in our office. And at that point, we can reschedule you for a piercing if you'd like to. So you'll be back to wearing your earrings in about 1 month from your procedure. For more related advanced answers, select one of these videos, and please don't forget to give us a thumbs up and subscribe to our channel for more educational videos, live surgical footage, real patient experiences, demonstrations, and so much more. You can also contact me at hope@351face.com and let me know some additional topics you'd like to explore. We'll see you in the next video.